Hi, good morning. My name is Dr. Kuldeep Kumar. I am working as a pulmonologist at CK Birla Hospital, Gurugram. So I shall be covering one important topic, which is a dry cough, which is a common entity now in winters. So what all causes this dry cough? Because patients came to us with one and only symptom, that is dry cough, because it is not getting away with all kind of treatment and despite trying all home remedies as well. So what is a dry cough? What are all the causes? So causative agent of dry cough are 2-3. First and foremost is allergy. Second reason is infections. Third reason obvious is some systemic or any organ related problem which is manifested as dry cough. So what all allergies? Allergies are cold air, winters. So dusty environment and persons who are more prone to infections and allergies surrounding environments. So moment they are encountering with that allergy, they will develop cold and followed by dry cough. So dry cough, if associated with allergies, it is mostly upper airways related. Likewise, nasal allergies, nasal rhinitis, nasal sinusitis and pharyngitis. So these are allergy. Treatment of allergy, dry coughs are symptomatics like anti-allergics and some sort of food hygiene and prevention of exposures. Second is infections, and if infections are encountered somehow during your daily routine activity, so infections could be flu, viral infections, most commonly in winter season, change of seasons, and bacterial infections can also manifest as a dry cough. And these obviously are infections, so they can't be treated at home. So infections like if it is flu, so along with dry cough, you must be having any kind of fever, any kind of yellow kind of cough as well, which obviously going to change from dry after it will convert into wet cough. So treatment of infectious dry cough is depend upon the type of infection we develop. If it is a viral pathology, then treatment of viral is we have to take symptomatic treatment and rest, steam for at least 5-7 days and it will get better. And if it is a bacterial cause of dry cough, obviously we have to go to a doctor and we have to take a course of short antibiotics, our cough will go. And third and foremost reason of dry cough which I enumerated is if it is associated with system involvement like organ involvement. If it is associated with respiratory system, likewise asthma, COPD or any kind of respiratory obstructive sleep apnea, obviously treatment should be very much different as in other things. Likewise, if it is asthma, you will require a nebulizers, you will require bronchodilators, you will require, if it is a severe kind of dry cough, you will require a short course of steroid also, but not antibiotics. And if it is a COPD, obviously grade of COPD, it will be categorized into, if it is a mild, obviously one kind of nebulizer. If it is a severe kind with a dry cough, it may lead to hospitalization. So early we have to take nebulizers regularly so that this dry cough will not happen. Other causes of dry cough would be associated with cardiac reasons, that could be congestive heart failure, or we are cardiac patients, or we are renal patients. Likewise, if we are developing shortness of breath because of the fluid accumulation into the lungs because of renal cause or cardiac cause. So whatever is the reason, if the system is getting corrected with the specialty involved, so dry cough can be relieved and treated subsequently by the treating physician. So this is the very important thing, how to deal with dry cough, especially during change of season. Thank you so much.